but we'll make sure he gets in front of you guys sometime soon. He's also Jenny's neighbor, we just discovered, so she'll be able to track him down, I'm sure.
He's our neighbors.
You're all their neighbors, actually. All of you around in that neighborhood, Grove West, he lives in Grove West. Personally, before I went into politics, lest you think I'm a heartless political hack, I used to be a legal aid attorney, and before that, I worked for an NGO in India called the National Foundation for India, where we did sustainable development work. So I personally care a lot about these issues.
Awesome. Great. Thanks for coming, Minnie. And I have a
Thank you for inviting me, and I apologize, I have to leave a little bit early to go to another event at Congressman, but I'll be in touch with Jenny.
And I have a packet for you before you leave that I want to present to you at the right time, but if you have to slip out, I'll stop what I'm doing and give it to you.
Okay, great. Thanks.
My name's Mary. I work here at the church. I'm the facility coordinator, and I heard about this program through Jenny and wanted to come and listen and see what it's all about. I myself have been real fortunate and got a ministry trip to South Africa, and just love the people there, and just kind of curious as to what's going on.
Thanks. Glad you're here.
My name is Sarah, and I know Jenny from the church. I go here as well, and I didn't know this was about Africa at all, but ever since I was a little girl, I have a sister, and we wanted to save Africa, and so this is just amazing. And I'm a pre-med student right now, and I work at a nonprofit, so my heart is very much in serving people. So, and I'm from Boston, so yeah.
Thanks, Sarah.
Thanks for having me.
Hi, I'm Stephanie, and I'm originally from Louisiana, which is one of our very impoverished areas. And I'm now an epidemiologist for the county. I do work in child death review and maternal health. So I'm always in it for empowering women and bringing women into it up. So, and Jenny, my
We have the same degree, so
Public health.
kindred spirit. Thank you. Glad you're here.
And I'm Marilyn, and I was born in Ohio, and but I've been in Houston for 44 years. So. And Jenny invited me, and I'm just interested in learning more.
I'm Robin. I'm from Baltimore. I've been in the Houston area for on and off for about 7 years. I'm a friend of Jenny's, and she's so excited I had to find out more about it.
Thank you. Thank you all again. I'm so excited you're here. How many of you have heard about CARE before I mentioned it? Just a couple. Well, probably you're all familiar with CARE to some degree. They started after World War II, sending care packages over to Europe to help people with the devastation there. They were actually a surplus of Army stock. It had canned beef, powdered milk, coffee, chocolate, and something Europeans didn't know what to do with, which was bubble gum. And they have since expanded from those original care packages to working as a leading humanitarian organization in the world, focusing in developing countries where people live on less than $1 a day. So really the most impoverished poor people in the world. And I'm going to reference my notes here some. I want to get started and show you all a video and tell you 2 more things about CARE. CARE is part of a global movement to empower women in the fight against poverty. Around the globe, CARE works to address the underlying causes of poverty through projects that advance education, improve health, provide economic opportunity, and meet emergency needs during and after a disaster like those in Honduras or Nicaragua when the Category 5 Felix hurricane came through. CARE is right there doing fundraising and providing support for those people, like those that are suffering from displacement in Darfur from the genocide. They're the last remaining NGO helping. CARE believes that the status of women is key to fighting and ending global poverty. That with education, skills, and basic opportunities, women can reach their full potential and become catalysts for change. So let's watch a quick video about CARE, and then we'll come back.